Acute glomerulonephritis, AGN, is an inflammatory disease of the kidneys in which the glomeruli, the filtering units of the kidneys, are affected. These structures are responsible for filtering the blood, removing waste products, and maintaining the body's balance of fluids and electrolytes. When the glomeruli are damaged, their ability to filter the blood diminishes, leading to the accumulation of waste in the body and disturbances in fluid and salt balance. Before we dive in, please note that all the information in this video is created by real people and carefully fact-checked. Causes and risk factors. Acute glomerulonephritis often develops following bacterial infections, such as respiratory infections or streptococcal infections, e.g. strep throat. This can be triggered by the body's immune response to the infection, where antibodies begin attacking the kidneys. Sometimes the disease is linked to viral infections, hepatitis B and C, HIV, or autoimmune diseases, e.g. systemic lupus erythematosus. Symptoms of the disease. The main symptoms of acute glomerulonephritis include edema, swelling. Swelling is particularly noticeable on the face, around the eyes, and can also appear in the lower limbs, especially in the morning. Changes in urine. The urine may become dark, resembling meat color, due to the presence of blood. Foam in the urine indicates high protein levels. Hypertension, high blood pressure. Due to impaired filtration, the kidneys are unable to efficiently remove excess fluid, leading to elevated blood pressure. General malaise. This includes symptoms of intoxication, weakness, headaches, fatigue, and loss of appetite. Pain in the lower back. Some patients experience discomfort in the lower back, near the kidneys, which can worsen with palpation. Diagnosis. The diagnosis of acute glomerulonephritis begins with a thorough physical examination and medical history review. The doctor will inquire about any recent infections or illnesses. Several laboratory and imaging tests are performed to confirm the diagnosis. Urine analysis. This test reveals the presence of protein, blood, erythrocytes, and CAS, indicating glomerular damage. Blood tests. Elevated levels of creatinine and urea in the blood may suggest kidney dysfunction. Tests for antibodies associated with infections may also indicate inflammation in the kidneys. Kidney biopsy. In some cases, a kidney biopsy may be performed to assess the extent of damage under a microscope. Treatment of acute glomerulonephritis. Treatment for acute glomerulonephritis involves several approaches. Anti-inflammatory medications. Corticosteroids, e.g. prednisone, are prescribed to reduce inflammation and suppress the immune response. Antibiotics. If the disease is linked to an infection, antibiotics are given to eliminate the infectious agent. Diet and fluid control. Patients are advised to follow a low-salt and low-protein diet to reduce kidney load. Fluid intake is monitored to prevent edema. Antihypertensive medications. Blood pressure-lowering drugs may be prescribed to control hypertension. Potential complications. If acute glomerulonephritis is left untreated or treatment is delayed, the following complications may occur. Kidney failure. This can be acute or chronic when the kidneys lose their ability to filter blood effectively. Hypertensive crisis. Persistent high blood pressure can lead to a stroke or heart attack. Edema. Progressive swelling can lead to respiratory issues, especially pulmonary edema. Infections. As the immune system is compromised, other infections may develop. Prognosis. The prognosis for acute glomerulonephritis depends on the timeliness of treatment and the severity of the disease. With appropriate and early intervention, many patients can restore normal kidney function. However, in some cases, the disease may progress to chronic kidney disease or cause irreversible kidney damage. Prevention. To prevent acute glomerulonephritis, it is important to regularly screen for infections, especially after respiratory illnesses, streptococcal throat infection, and others. Monitor blood pressure, as hypertension can exacerbate kidney issues. If there are chronic conditions like diabetes or hypertension, it is essential to keep them under control. Conclusion. Acute glomerulonephritis is a serious disease that requires careful diagnosis and treatment. Timely intervention can help avoid complications and preserve kidney function. Preventing the disease involves avoiding infections and managing chronic health conditions.